Hi, Dr. Gaurav.
No, ma'am.
Hi. So it's really nice to have you over here.
Thank you.
And I do watch a lot of your YouTube videos, and I know you're very social media savvy, very tech savvy, and have always admired your social media skills and also your interventional radiology skills. And it's really amazing to see such a good work. And I think everybody should know what you're doing, and we should also pass on to this younger generation. And that's the whole idea of this podcast, so that people get to understand and learn from people who are already in it and who get inspired by people like you. So,
Thank you.
thank you so much for coming today. So, straight away, we will dive in straight into the topic today. So, first, let me understand a little bit more about you. So, can you tell me, where exactly you did your medical school and how did you get into interventional radiology? Just tell us all about it.
Sure, ma'am. So, of course, right from my childhood, I wanted to become a doctor. Maybe because of the impression set up by my parents. It was their unfulfilled dream which they wanted to fulfill through me.
Huh.
So, even before starting schooling, this was imparted on me. You have to become a doctor. So, I
Okay.
never thought of any other choice except becoming a doctor. I did my MBBS from Nair Hospital or Topiwala Medical College, Mumbai.
Huh.
And after that, I got a, again, after finishing my MBBS, I was very sure I want to become a surgeon, a general surgeon or an ophthalmologist. But I got a decent rank in DNB, and everyone told me you have got a decent rank. Everybody who gets a top rank goes for radiology. So you're making a big mistake going for surgery. But then I said, okay, let me start radiology, and I have 5 rounds. I can always switch over to my dream branch.
Yeah.
Till that, let me acquire some imaging skills, which will help
Right.
me in surgery. So I never intended to become a radiologist or an interventional radiologist later. But when I started radiology, a small magical moment happened which forced me to choose this career and give up my dream branch. So, in one way. So, I was a first year postgraduate student, and we had a visiting interventional radiologist, Dr. CPS Chauhan, who used to come for procedures,
Okay.
which an interventional radiologist usually does.
Uh-huh.
So, a reference was sent by the liver transplant team saying that there is a patient with a pancreatic cancer, a small mass, and incidentally detected small nodular lesion in the liver, one of the segments, caudate lobe, to I cannot forget it, caudate lobe, which was around 5 millimeters in diameter.
Oh.
And they said, let's give a reference to the radiology team to do a biopsy because it matters whether it's a mets or it's just a
Yeah.
incidentaloma and
Yeah.
it's just a solitary stage 1 CA.
Yeah.
So 4 or 5 senior radiologists, senior registrars saw it and said, no, it's not possible. It's in the caudate lobe. It's 17 centimeters away from the skin. So, and it's 5 millimeters. There's no way we are doing it. So you just assume it to not be meds or do a open surgical resection or something, but we can't target it percutaneously. So Dr. Chauhan was given a reference. He came in and all my seniors made me call him and tell him that you're coming all the way 60 kilometers for no purpose. You will come and abandon the case. But he said, okay, I have to respect the surgeons. Some of them are very senior, the pioneers of pancreatic transplant in India. So I have to respect them. I'll come, I'll say it's not feasible and I'll go. I
Yeah.
can't say just on telephonically tell them it's not feasible. My juniors are telling me. So he came, he took 5 minutes for assessment, not even five, I would say he took 2 minutes for assessment and he said, let me try. I think it should be feasible. I may fail. No, I'm trying because the clinical management can change because of
Yeah.
this. So he went in. At that time, I guess there was the coaxial system was just introduced. We didn't have it in Stephen where I was doing my
Uh-huh.
post graduation. He went in with a 16 centimeter long 18 gauge needle. He took a clean biopsy through that lesion, which all of us could see.
Right.
And I could see the needle piercing the normal parenchyma, the nodule 5 the normal parenchyma again, distal to the lesion.
Wow.
And he did it at least 6 times
Oh my
because
God.
he wanted enough sample for immunohistochemistry, maybe genomic
Was the tumor
sequencing.
still there? He said it's a 5 tumor.
Yeah. So, and in the end, I could see all 6 cores appearing morphologically also in the formalin as white, red, and sorry, red, white, and red cores. So I
Wow.
could see normal liver lesion and normal
Yes.
liver in all of them.
Yes.
And he just said in the end, so he finished it in maybe 2 3 minutes. And in the end, he told me, okay, this is. In the end, he told me that I was lucky today. Maybe the surgeon desperately wanted it. It was a patient's lucky
Yeah.
day. Do give me the follow up. And he just left. And that was the moment where myself, two, three others registrars, our jaw dropped, and my career decision was made. If I want to do something, I want to do this.
Wow.
I want to add to the patient's medical decisions. I want to help the surgical teams, which really would have been in a very difficult situation had this not been done. Doing a excision biopsy laparoscopically or open is easy to say, but it would have been a big difference to the patient. And I wanted to do it in this style. I loved the class with it and the humility with which he did it.
Wow. Yeah.
So yeah, that was the reason I chose this career path and decided to be an interventional radiologist that day on.
Very nice. I think we all should thank him for this, for inspiring you, because otherwise, IR would have lost a brilliant person like you. And you said, he's a very humble, and, you learned something from his humility as well. And you also come across as a very humble, and, I always appreciate your humility in whatever you do. And you have a very calm demeanor, and, the aura that you carry around you. Is that something that you've always carried all your life, from your childhood you've been like this, or is there something which made you into what you are right now?
I have been an introvert always, but there was a phase of life where I was very aggressive.
Oh,
I was into boxing, into fights as a teenager. So
wow.
I was even considering changing my profession and switching to more of combat sports or something like that. But of course, I had good mentors. There's a famous monk on YouTube by the name of Gaurav Das,
Yes.
and I had the opportunity during my MBBS to get 6 years mentored by him
Oh
when he
my
was
word.
not on social media. Nobody knew him at that time. So I'm very grateful to him and the spiritual practices that he followed, which really helped me calm down, reshape the way I used to think. And I won't claim that my humility or overall attitude is genuine, but he always taught me fake it to make it. He said, even if you don't have it, no problem. You keep practicing it, it will develop with time. Of course, with other spiritual practices. And so I owe my a lot of my personal life to him as a mentor. And then of course more spiritual teachers followed. But point is, yes, so my not even my not only my academic inspiration, but even my material life to follow the principles I owe it to mentors. So I feel mentors shape your life a big way if you just allow them to guide you.
Oh wow, totally. I mean, no wonder you've been, Gaur Gopal Das was in your life, because I do follow a lot of his YouTube
Oh,
videos, and
great.
it's very inspiring. And I often try, to have this very calm demeanor, but it's not in my purview to be like that. So, but then it's really nice that you had the exposure of this monk, and I think it is very important, not just in this profession, for a human being in general to have an understanding or to have some spiritual insight to carry on with whatever you're doing in your life. And I think that really goes a long way. But hats off to you for that. And if you ever give us a chance to meet Gaur Gopal Das, I think I'll be the first person to come and visit him. So very nice, of you to do that. And moving on further into the same topic, you also come across as a very dynamic person in terms of your social media posts, whatever you're doing on the social media, because now we are living in an era wherein everybody needs to be on social media, is my personal opinion. And as I said, I belong to one generation above you, and we probably are not that tech savvy. But at least for people who are taking up the specialty now, who are getting into interventional radiology, I think they need to understand what we need to do in our day-to-day life, especially in our practice, not just in IR, generally for everybody, for every doctor. What made you become social media savvy, or what were the insights that you had before you just dived into this, your YouTube channel, your Insta, LinkedIn posts? What was the driving force for you?
So there were two driving forces again. I am a person of stories, so I'll share in the whatever I experienced, what pushed me to
Yeah.
this. One was a constant, I would say, dissatisfaction or irritation by the fact that nobody is aware of such a magical specialty. This is a problem solving tool which can help treat diseases without the regular invasive surgeries, without anesthesia, without scars, and at a very quick recovery period, sometimes as short as hours, the patient can walk home. and there is no awareness of it. So that was always a concern in my mind. And I always say, if you stand at a hospital reception, you will see people coming and saying, I need to see a gynecologist, I need to see a gastroenterologist. No one ever has come and said, I need to see an interventional radiologist.
Yes, yes.
Except, of course, few places where people have really built the practice, like your center, what you have done as a pioneer. So, really inspiring. So, uh, even if it exists, as I said, it exists in a few tertiary care centers, and even there, it's predominantly a referral branch. When a clinician gets in trouble, like the case we mentioned, where they needed a biopsy, they
Yeah,
refer.
yeah.
But a patient has no access that there is this specialty which can help me directly. That was always a subtle concern back of my mind going on and troubling me. But like all my colleagues and peers and seniors, sometimes juniors, always that thought, who will go into social media? It's not a doctor's piece of cake. The investment, the equipment,
Yes.
lack of knowledge,
Yeah.
all those challenges always stopped me.
Yeah.
One fine day, the second emergency trigger which pushed me to start it immediately was one fine day in the casualty where a young, I guess it was a 20-year-old girl, I've talked about her story a couple of times, who came with a large vessel brain occlusion, a clot in her brain vessel, and she came with a massive ischemic stroke. And we referred her for CT imaging. We found out the cause. We knew if we do a procedure called mechanical thrombectomy just with angiography, we can reverse it in time. And with a 70% chance by 3 months, she'll have a normal life, or at least not a dependent life. And the critical phases would be over where she can meet death, she can be in coma. So, but her family wasn't around. It was only her younger sister taking the calls. One relative came, he said, no, these people are just scaring you and pushing you towards a major surgery for money, which is the general perception. In fact, that was the peak time where media, movies, Gabbar, and many other movies were talking about this. Satyamev Jayate kind of shows that doctors are pushing you to surgeries, creating a false emergency just to mint money. So that was the perception. I don't blame them. They took her to a nursing home. 12 hours later, the relatives came back saying, sorry, we made a mistake. The neurologist just showed up after 12 hours and says this is emergency. We did the CT scan again and the brain was all dead. The 35% that we were trying to save was completely
Yeah.
ischemic. So we told them, sorry, we can't do anything. She ended up with a craniotomy, removing a skull flap. Uh, and eventually, of course, recovered, but we knew she will never lead a normal
Yeah.
life. She would always be dependent. So that pushed me. I thought, no, till what point of time can I keep blaming the media, the movies, or the narrative that was going on? What have I done to make a difference? I always wanted to create awareness of this specialty, of the diseases, and how we can treat it. But what have I done to contribute? And that day, I went home. I had a very average kind of phone then, and I had a small gimbal kind of device, a tripod,
Right.
and I, keeping the phone in my hand with the front camera, I shot myself a stroke video,
Right.
and to follow up a thyroid nodule and a varicose video, and I posted it. And that was the start of this journey, of course. Then
Wow.
with time we kept on refining. Now we have teams in place. We kept on getting better at it to create again. But the basic intent was awareness, and that is something we feel we have done, but there is a long way to go.
Right, yeah. I mean, what is the piece of advice that you want to tell? See, generally, when people are on the social media, most of the times they do it for likes and followers. Of course, the more the followers, the more the spread of the message or the more the awareness. That is a secondary thing.
Yeah.
But I think one needs to be very, very spiritual with a very profound insight to be able to, have the courage to post despite the number of views, despite the number of likes, which is what the youngsters do. Because when I speak to few people, they'll say, oh, we do this, we post it, but not many views, so there's no point. And then that kind of discourages them from continuing further. Did you have any initial disappointments, like when you started posting? People may not have noticed it, and you probably would have felt a little disheartened that this post is not reaching. What made you continue with your posts?
I will here again take the opportunity to mention my mentor and his advice, which helped me.
Yeah.
He told me two things. He said, you do what is needful, you study the algorithm, you study what helps grow sooner, again with the central intent of awareness in mind, and you keep growing towards that consistently for a defined period of time before you conclude that this is not working. But he told me a second thing. He said, while you do this, while you work on the actionables that to improve, don't work for the result, especially for the likes, comments in this
Yes.
kind of situation. He said, because if you do that, you will never become an instrument of the divine to do something good. So,
Yes. Yeah.
so he said, you be detached and keep doing it with good intents, and things will happen. You will become an
Yes.
instrument, and things will happen. And I've seen that not only in the beginning, but even at these stages. Whenever I'm more interested in how my videos will have more reach, I have been very artificial in terms of trying to calculate analytics. I do
Yeah.
that. I still do that, of course,
Yes.
as a actionable.
That's to reach to a lot of
Yeah,
people. Yeah.
yeah. So, and there is a science behind that. Each social media platform has an algorithm, so that should be studied and actionable should be done. But ultimately, the central intent should never be forgotten. And yes, if you do that, you allow yourself to be more of an instrument. I'm sure you would do much more magic than
Yeah.
trying to be artificial and just reaching people more, or
Right.
boosting things with something known as black hat SEO and all that. It doesn't work. They're not sustainable. The audience sees through you. So finally, after this journey of, I guess, more than 4 years, I have realized that we keep trying to study the algorithm, and I say 30% that should be done, but 70% we should understand the hearts of people. Ultimately, if you see all the mid-successful social media content creators, they talk about algorithm, how they cracked it. But if you see the best, they know how to catch the people, people's heart, how to, and that their personality, their presentation is something which is etched in their audience's heart. So
Yeah.
I guess be natural and try to catch what people want with the good intent which you started with in mind, and you will reach
Oh.
sooner or later.
Oh, beautiful, actually. I mean, as I said, Dr. Gaurav, you always inspired me. And this I'm saying it from heart. But then talking to you, having that, that calmness and composure, and especially with your background to your spiritual guru, I think it inspires me more. So, just to recap what you said just now, it's like I think with the right intention, by being authentic, by staying detached to the outcome, by not worrying about the results, that will take you far in life rather than sitting and brooding over what is going to happen, who is going to watch, how many followers I'm going to get. I think this is something that every youngster and everybody who is on the social media should understand. So Dr. Gaurav, now you said, how or what triggered you to get into social media, how to stay detached. The next thing is, when do you find time? I mean, I know you're a busy person. And tell me, where do you work? I don't think we discussed until
Yeah.
now about your center, about your setup, and how do you find time? So we have two questions in
Yeah.
one question. So, yeah.
So basically, I have a clinic which is a standalone independent clinic called Dr. Gangwani's Vascular Clinic. It's right now in Borivali, one of the western parts of Mumbai, where it's on the highway, a decent location. So I see all my patients whose, so 95% of my practice is based on social media. People see me on YouTube or Instagram or Google, and they visit my website, they book an appointment, they come to me.
Okay.
So they come to my clinic, I see them there, and then for operations or minimally invasive interventions that we call it, I am attached to 4 different hospitals based on the patient's choice and various other factors. The patient chooses which hospital he wants to get operated in,
Uh-huh.
and then we operate in one of these hospitals.
Wow.
So that
Okay.
is the practice that I do.
Uh-huh.
We are fairly bit of busy because of our social media presence. So I have a big team, at least 3 secretaries who handle the calls, and so yes, and we are on an average 2 to 3 weeks booked in advance. So yes, I do agree that it's very busy, and sometimes doing social media is not easy. But one thing we have realized over a period of time, that unlike any other field, social media is one field where you cannot be inconsistent. So people always like the fame or the reach that content creators, especially the good ones, attain. But if you study in detail, sometimes you see a channel of a particular content creator for the past decade, and in 10 years he has not missed a single post.
Yeah.
And that is what we have done the same. I mean, for the past 4 years, whatever frequency we decide, we never skip a post.
Right.
So we have uh, followed 2 principles for this. One is we have kept a slot for social media separately during the week. So our Wednesdays morning slot 8 to 12 a.m. 8 a.m. to 12 p.m. is untouched. we will either script or shoot or do the editing or suggestions during that period.
Right.
And in case somehow we miss that week, we will take a second backup day, let's say that Sunday. Of course, miss the weekend, but we'll shoot on that day or script on that day. So we have tried to be consistent in that ways, and we batch our content. So if I'm sitting on Wednesday for 4 hours, I'll script for the next month completely, and next Wednesday I'll shoot for the next month completely.
Wow.
So
Okay.
of course, now saying that our content is increasing, we are making long videos on YouTube, shorts on YouTube, different
Yeah.
shorts on Instagram. So
Yeah.
it's a whole lot deal. So even 4 Wednesdays are not enough sometimes.
I know.
But yeah, like I said, we have backup days and we have to work extra. So it is not easy. There is a lot of investment in terms of times and resources first, and then now even in monetary terms, because we are growing, we have to maintain that production quality. So we have a big team, and there's a lot of financial inputs in that. But yes, in the end, we have, no matter what, we don't touch the consistency and frequency.
Right. Oh, wow. Wonderful. And after you started your clinic, your standalone clinic
Yeah,
that you're talking, how long did it take for you to grow to the level that you're in right now? I mean, I'm sure there'll be a time scale,
yeah.
right? Yeah.
So actually, it happened the other way around.
Yeah.
I was a full timer specialist in a single hospital.
Okay.
We took around 3 to 6 months there to start from scratch, build up an interventional radiology department, and bring it to a level where we were doing around 70 cath lab interventions a month and a lot of percutaneous interventions. Over a period of 3 years, there were a lot of issues in terms of resource sharing with other specialties, lack of awareness even amongst the management,
Huh.
other challenges which are there in a single institutional setup sometimes. And I decided to quit. I decided to start my own practice. And when I did that, I had no idea what I'll do next, because 4 years I've invested my heart and soul working around 12 to 17 hours a day in this single hospital. And now what do I do that I move out? So suddenly that is the time where our social media blew up. And like I said, I never intended it. Maybe the divine energy played a role. When I just needed it, it blew up. We could reach people. People started coming to us for a lot of novel interventions like thyroid nodules, enlarged prostates. And since that day to this point, it's been more than a year and a half, and we have somehow always been busy throughout the year. So when I started the clinic, once I moved out of the hospital, within the first month we had enough work, and
Wow.
till date it's sort of similar.
Okay. So would you consider that to be an element of luck as well in that, or is
Yes.
it, yeah?
I
Definitely,
would
yeah.
be lying if I say that there was no luck. I was
Yeah.
probably in the right place at the right time also.
Uh-huh.
I was one of the first interventional radiologists to start this. There were a few channels which were doing something inconsistently, but to start this consistently, following the algorithm and
Yeah.
uh, reaching with the right kind of novel interventions which people were
Yeah.
looking for. So yeah,
Yeah.
there was a big role of luck in that.
Wow. Okay. So when you say algorithm, how does it work? I mean, YouTube. I know everything. Insta has got a different
Yeah.
algorithm. So can you just tell me the basic differences?
So, I mean, if I have to go into it, there are more than 12 to 15 factors
Oh,
that
okay.
play a role in the algorithm. But as the biggest YouTuber, individual YouTuber in the world, Mr. Beast says that there are two main factors which are the, I would say, spine of the algorithm. Whether your content is being clicked by the audience, and if they are clicking on it, whether they are staying on it.
Okay.
So which are technically called as click-through rate. I mean, if your thumbnail, YouTube is showing your thumbnail based on your metadata, your text that you input in the title, to 100 people, how many actually click on it?
Ah,
And second is, if they click on it, how long do they stay on it?
yes.
So how many people stay for the first 30 seconds, and then how many people watch what extent of the video? Something known as watch time and audience retention, for which first 30 seconds retention matters extra. So yeah, so I would say for the YouTube algorithm, these are the two principles that matter the most. Now there are 10 other factors, and everything is a science. So
Yeah.
how to choose your title is a own science, where metadata is calculated according to the SEO, search engine optimization. So it's a long story, a long technical description, but
Yes.
this is the basis of that.
Right. How important do you think is this to be incorporated as part of a curriculum in IR?
So ideally, a doctor should not have to worry about this. Ideally, if he is employing a good digital marketing agency or
Yeah.
team, if he can do that, let's say in the beginning, or if it's an institution investing in it, they are supposed to know this science. Unfortunately, after burning my hands with maybe 9 or 10 different agencies, I know that 90% of the agencies out there don't know this science, and they don't take the effort to learn this
Correct.
when actually this matters the most to get that reach. So we have to do it ourselves. I would say it should be there in the curriculum, but then that is, I would say, wishful thinking, because we want so many things to be in the academic curriculum of our children:
Yes.
financial education, sexual education. It's not there.
Yes.
Spirituality, it's not there.
Correct. Yeah.
So I'm not sure whether it will happen anytime soon. So till it happens, I would say everybody should learn it themselves.
Learn it themselves.
Yeah.
And how do you think we can motivate people, or what is that piece of advice that you would want to give to younger generation to stay motivated
Yeah.
and do something on the social media and to grow their practice in day-to-day life?
So, whenever I feel occasionally burnt out, feeling that there's so many things on the plate, you have to do surgeries and OPDs and health, family, and then social media, which is a big investment in terms of time and resources. And whenever I try to figure out, I was anyways working and having enough number of patients, why should I do this? uh, I sit in my next OPD and I see, let's say, 40 people in a day coming from different parts of the country, some of them coming from different parts of the world, where they share their stories how they have thyroid nodules or breast fibroadenomas, enlarged prostates, and they are from either some small town or sometimes Western countries also, where they were never shared about this alternative, minimally invasive alternative by their clinicians or surgeons.
Okay.
And having this platform and where they could learn about this, that there is a minimally invasive alternative
Yes.
available,
Yeah.
and they could come to us, is a, I would say, biggest motivator, gratifier in itself. And when these people come back showing us the results, that I mean, I remember we do treatment of thyroid nodules in minimally invasive fashions by ablations or interventions. And I still remember my landmark case where we did a 910 cc nodule from Gujarat. The
Wow.
patient came and we did 2 sessions of embolization, and today that nodule is 40 cc and
Wow.
completely necrosed.
Oh, wow.
So creating that difference to patient's life, where he
Correct.
is avoiding a supramajor neck and chest surgery and everything is getting treated through a pinhole in his wrist. So the that is one of the biggest motivators. Second, I was sharing on one of the podcasts recently how I met a colleague professor from Cleveland Clinic, US,
Uh-huh.
and he shared that they have started their first 2 cases of thyroid embolization, and here in India I have finished 130 cases. So that is a second motivator, that we are not only following or emulating the footsteps of the West now, but we are actually leading in terms
Surpassing.
of
Yeah.
numbers, and now they are looking forward to our numbers and taking inputs. I had a second university where I had the opportunity to take a small webinar for them on thyroid ablation and techniques and tips. But all this could come because of volumes and numbers. So, and social media gave me that. If today I tell my hospital and create awareness saying that, okay, I treat thyroid, maybe the ENTs, the endocrinologists, even if they are unbiased, they are patient centric, they would be able to send maybe 1 case a month. But now I'm doing maybe 10 to 20 cases a month
Wow.
in all. So yeah, these two are the biggest motivators for me to continue and keep pushing. And this gives me a whole deal of liberty. I can even my negotiation with the hospitals in terms of the resources I need, the best quality machines and infrastructure I need changes. As a doctor who goes in and says I need equipment worth of 3 crores for giving the best quality care to my patient, hospital management may not be that enthusiastic because they're not sure of the return. But here, when they know he'll do 20 cases a month, they are very happy to invest
Yes.
there.
Yeah, they're seeing the
So,
results, so they
yes.
want to invest.
Yes. So I
Oh,
can bring in the quality that I want almost at par with the Western world and give it to my patients. And then, so all this that I achieved is only because of social media and because of my patients and my audience. So I would never want to stop this.
no, I'm sure, but it's again, I would want to talk to you so much, and it's so inspiring talking to you, as I said. But because of the lack of time, I think we may have to stop here. But before I stop, are there any workshops that you conduct, both in IR and also for social media engagement?
This one.
Yeah,
So there are both. Um,
yeah.
right now, I don't have any official fellowship program under my care, because one problem because of social media is that when people watch you, build trust based on multiple of your videos, then do some research on your reviews on Google My Business, etc. When they come, they expect you to operate. They
Ah.
won't let anyone else touch. So because of that, I'm not able to train anyone for in the long term, because I wouldn't do justice by not giving them any hands-on experience. But I do conduct monthly or twice monthly workshops for thyroid ablation, thyroid embolization.
Right.
I'm planning to do the same for multiple novel embolizations very soon. So yeah, for many trainees, I have already had the privilege to host around 70 or 80 IRs across the nation
Wow.
for these workshops. And besides that, yes, I had started a course on social media awareness for doctors, or rather social media algorithm for doctors and how to crack social
Yeah.
media. Right now, that workshop officially I have stopped it, but whenever a doctor approaches me, I am happy to share all the videos, the course material with them. It's a 8-hour course, a small course that I have created for them to understand this and not get scared by the all these SEO algorithms and everything. So I've simplified. Some part is technical, some part is the tips we have learned over a period of 4 years. So I'm
Right.
happy to share it with colleagues. There's no official course as such. If I create some in future, I'll let people know. But yeah, right now I'm just happy to share it with.
I think it would be brilliant if you can do some online. I mean, I'm sure for thyroid ablation and embolization, people need to be there.
Yeah.
We cannot really absorb that information
Yeah.
online. But then the social media engagement and the algorithm understanding, if you can make it online course,
Yeah.
at least maybe as a day course or a half a day course, I'm sure there'll be a lot of people who are interested. I'll be the first one to register. Uh, so I think it'll be a very useful thing. So
Sure.
please do think about it. If you're planning to do one, let us know.
Definitely.
And but otherwise, thank you so much for sharing all your insights, your inputs, and it's you will go very, very far, undoubtedly, and you're already there. And that's all I can say for today. But thanks once again, Dr. Gaurav. And hopefully, we just get to, I hope we get to do another podcast with you in detail with an in depth analysis. Thank you once again.
Thank
Thank
you,
you
Gaurav.
all.
Thank
Okay.
you.